the Regional Council meeting of April 30th. Before we take attendance, I want to point out that we have someone who's transcribing our meeting, so please speak slowly, that's addressed to me, but clearly, and identify yourself when you speak. We'll begin with a roll call vote. A roll call attendance.
You know what he meant. Okay,
Great-grandfathers are allowed to be confused.
so congratulations, another grandchild. Okay.
Point of order.
Doug Jacob,
President, I read the book.
Ari Weiss, Denora Claudio, James Booth, Christine Mazzola, Bradley Kaufman, Samia McKeechin, Samia McKeechin?
Yes.
Okay. Allison Burke,
Present.
thank you. Dominic Battinelli,
Present.
William Goffin,
Here.
Joseph Marcelino,
Present.
Daniel Mizell,
Present.
Mordecai Goldfeder, Robert Bristol,
Present.
Daniel Rodriguez, John Johnstone,
Present.
Martin Grillo,
Present.
James Downey,
Present.
Gerald Gelbard, David Mikatansky,
Present.
Joseph Schenker, David Benelli, Scott Orlansky,
Here.
Mordecai Lax,
Present.
Martina Barcarella,
Present.
Vincent Barranco, Scott Chiang,
Here.
Arthur Cooper, Robert Krupe,
Present.
Megan Farley,
Here.
Madfred Fuchs,
Here.
Sean Graves,
Here.
Jerry Gumbo,
Here.
Yadidja Langsam,
Here.
Brian Levinsky,
Here.
Dennis Laurie,
Present.
Mitchell Powell.
Present.
We have a quorum. 2, 3, 4, 12. 22. I'm going to pass around the attendance. We have a quorum.
Okay, we do have a quorum, we'll proceed. The first item on the agenda is really not printed on the agenda, but is going to be a report from your executive committee on an action that we took last week. You have a right to oppose that action, but for reasons of time, it had to be done last week. So the REMAC, and the rest of the REMAC report will come later, but the REMAC had made a protocol change concerning, and let me read you the language. In the GOP, Transportation Procedures Decisions, the REMAC, their executive committee, approved the following change in language. Among the items of where you must take your patient to, it says that ambulances may bring patients to regionally approved alternative destinations if the patient meets criteria established by regional protocols for that destination type, which in ordinary English means that if it's appropriate, you can go to urgent care centers, you can go to birthing centers, you can go to other than emergency rooms. And this has been a state policy for a long time, but our protocols have never included it. We needed this to go up to REMSCO for next week's meeting so that it could be approved. So the language of this paragraph was wordsmithed by the executive committee of the REMAC, and then the executive committee of REMSCO approved this language. So unless someone has an objection and one makes a motion to undo this, we will just proceed. Hearing none, the executive committee decision stands. We now move to the correspondence report. From the fire department, we received PCR monthly inventory control reports for February and a list of non-compliant PCR form submissions for February as well. From the New York State DOH, we received public notice from the DOH regarding some individuals to be read into the minutes. So Jose Riviera, EMT 394927, was revoked effective 4/2/19 for violations of Part 800.16A4. We received emails and letters from New York State DOH regarding Bellevue Hospital's approval as a provisional Level 2 pediatric trauma center. Okay, we report that New York City Region has currently 10 agencies participating in the PEC program. If you don't recall what the PEC program is, it is the Pediatric
Emergency
Care
Care
Coordinator,
yeah.
okay, which the state has asked us to come up with people. Every agency is encouraged to have one. We have now 10 agencies have come through naming individuals. We have received transfer of operating authority application from Emergent Care, will be dealt with later. Transfer of operating authority application of Empress. All of these applications and public notices and certificate of fitness letters were all received, and we will discuss this under the ambulance committee's report. We received PISI scholarship applications from 2 individuals. We received a notice of New York City Council public hearing on Finley ambulance costs held on April 15th. And we received a PAD public access defibrillation application from the New York City Business Integrity Committee. We have a series of EMS award nominations. And is that on today's to vote on?
Yes.
Okay, but it's not on my agenda. So we will later vote on these things, and I'll list off the names at that point, so we don't have to do this twice. The Office of the Council sent the following correspondence: agendas, minutes, and associated attachments. The PEC commitment to participate was sent to the New York City DOH. EMS on tour flyer was sent to all ambulance agencies, and the EMS awards ceremony announcement donation flyer was sent out, as well as a request for pictures. So if you have pictures or videos, either staged or for real, okay, please send them in to the office, and they will put together a nice presentation, which goes on YouTube and gets national hits, and it's a nice thing. Okay, that ends the correspondence report.
One thing I
Yes?
didn't add on here, we did send out, New York Presbyterian Methodist Brooklyn gave us call-in numbers for the volunteer BLS agencies so that they can fully participate in the stroke protocol, the new stroke protocol. And that was sent out.
And you want to probably announce that after the meeting, you want to give out as many of those cards and posters to take back to your agencies and hang them up. They look very pretty.
Yeah.
So please step up after the meeting and just take a batch.
And Joe is also going to speak, Joe Ranieri, about all the glucometers and other equipment that we have here. Please take them.
They're
Take
doing
them-
spring cleaning upstairs, and so out of our office into yours.
Yeah. And you can take them for to train. You don't need to just have them for your ambulance. You can use them for your training centers.
Okay, thank you. Emergency preparedness update.
Thank you. So as Marie stated, we have a wide variety of equipment here related to glucometry for agencies to take with them. They include glucometers, lancets, blood testing strips, as well as control solutions. Please be aware that the testing strips and control solutions are expired. So I would recommend that you utilize them for training purposes. Please take them at your leisure. They're all laid out in the back of the room. Please get them out of our office. So the council, we continue to participate in a number of healthcare coalitions throughout the city. Turns out that a lot of various healthcare groups have a very shaky handle on how EMS operates here in the city. As many of here around the table are aware, New York City is unique in how We have a very diverse system and a very interconnected system. So for groups particularly such as the VA hospital, who operates more on a national level, they were not aware of how our system was laid out. So, so staff, we've been attending these meetings, and it's been very productive in trying to educate our healthcare partners in what we do in EMS and how we operate and the things that we're able to do to help participate in these planning committees. So some of those exercises included the VA hospital NDMS tabletop exercise, which occurred last week, the Brooklyn Coalition cybersecurity exercise tabletop, which occurred 3 weeks ago, and the Brooklyn Coalition burn exercise tabletop, which will occur at the end of at the beginning of May. In addition, we are continuing to work with the New York City Department of Health to develop the after-action report for the 2019 SurgeX drill that we participated in back in March. We got some great pieces of information from that exercise. Once the AAR comes out, we are looking to present some of that information at the June council meeting. So just something to look forward to for our June meeting. Just a couple of quick reminders. We are continuing to do the territory mapping for the volunteers. We need agencies to send us outline drawings of their territory maps, right? You can do it right on Google Maps, right? Just take a pen, draw the line on the streets, and then we'll send that to Robert at OEM, and he's going to translate that into OEM's JS system. And then once we have that together for your agency, we'll send you the results so that you can verify that it's accurate. All right, so we haven't gotten a lot of response on that, so please, I'm going to ask the district chairs if you can make that a thing at your district meetings. In addition, we continue to distribute intranasal naloxone. That is available. The office continues to distribute it. If your agency needs it, just contact the office and we'll be happy to set aside an allotment for you. Everything we distributed a couple of years ago has expired, so if you haven't taken a look at your Narcan kits in a while, just pop them open, double check the expiration dates. On the EPCR side, the state is continuing its migration to NEMSIS 3. The next big vendor to start their transition over is ESO. So if your agency utilizes that vendor as your PCR system, contact them, see what their plan is to transition your agency over into the new NEMSIS 3 data set. Agencies should be aware that when you are upgrading to NEMSIS 3, you must send into this office a DOH 5136 form, right, so that we can do regional endorsement. It has to be approved by this body. And just prepare your providers for NEMSIS 3 as well. It's got almost double the number of data points as NEMSIS 2. So a lot of the things that were originally open text fields in NEMSIS 2 are now being moved to drop downs and things like that. Our regional PCR system is going well, so that's been fully rolled out. We just procured a grant to get some new tablets in support of that program. Once those new tablets come in and we get them set up, we're going to be opening up registration for additional agencies that want to join in on the regional EPCR system. Once again, we are offering that system at no charge for a 2-year period. So the cost for the agency will be your connectivity fee, so whatever Wi-Fi you need to get set up for your ambulance. Other than that, we're providing the software and we're providing some of the hardware for you to get started on that. I already announced the equipment. So we completed the rollout of our new rave notification system. We utilized it for a couple of drill events. Most recently, we utilized it pretty heavily during SurgeX. Worked pretty well. We didn't get any complaints about it. Over the next couple of weeks, we're going to have some new interns starting at REMSCO, and one of those interns is going to be tasked with reaching out to the individual agencies to verify their contacts. So, particularly in the volunteer sector, people change positions on a frequent basis, and we're not always receiving those updated contact lists. So we're going to start being a little more proactive on that end. And that concludes the emergency preparedness report.
Are there any questions? Thank you very much. Program agency update.
The program agency will be meeting next week in Albany, and I will come back with more information. Nothing new at this time.
Thank you very much. The ambulance committee report.
Good afternoon. The ambulance committee met prior to REMSCO meeting this evening. We reviewed some pieces of information. There were no new applications for determination of public need. We did review the new applications for the transfer of the operating authority, which there are two. One was on the emergency care, New York LLC 0670 to Paramedic Logistics Operating Company LLC Operating Authority in the Bronx and New York counties. The ambulance committee has made the recommendation to approve.
Okay, I will now take over from there. So we have a forwarded motion, which I will read, and then we'll have a discussion. Okay. The Ambulance Committee of the Regional Emergency Medical Services Council of New York City finds, now it'll say the REMSCO, finds, based upon the receipt of a complete application for transfer of operating authority of Emergicare New York LLC 0670 to Paramedics Logistics Operating Company LLC, and a review of competency and fitness having been conducted by the Regional Emergency Medical Services Council of New York City and the New York State Department of Health, and that review having revealed no issues challenging competency and fitness, recommends that approval of the transfer of operating authority of Emergicare New York LLC 0670 to Paramedics Logistics Operating Company LLC, operating authority in New York and Bronx counties, be granted. Before we proceed to a discussion, is there anyone here who wishes to recuse themselves according to the DOH guidelines? Is there anyone here who thinks that someone should recuse themselves and hasn't? Hearing none, we will proceed to a discussion of the motion. Is there any discussion? Hearing no discussion, we move to a roll call vote, and then this will be passed around for you to sign.
Yeah, number up to 22. So when I call your name, in favor, against, or abstain? Dove Jacob.
In favor.
Samia McEachin.
In favor.
Dominic Battinelli.
In favor.
Denora Claudio. Christine Mazzola.
Abstain.
Joseph Marcelino.
In favor.
John Johnstone.
In favor.
Robert Bristol.
In favor.
Martin Grillo.
In favor.
David Mekatansky.
In favor.
Scott Orlansky.
In favor.
Mordecai Lax.
In favor.
Martina Baccarella.
In favor.
Scott Chang.
In favor.
Robert Krupe.
In favor.
Brian Levinsky.
In favor.
Megan Farley.
In favor.
Manfred Fuchs. Sean Graves.
In favor.
Jerry Gumbo.
In favor.
Didger Langsam.
In favor.
Dennis Laurie.
In favor.
Mitchell Powell.
In favor.
The motion carries.
Thank you. Introduce the second one.
Yes, in review of the new application for the transfer of operating authority, the second was the Empress Ambulance Service Incorporated, 5930 to Empress Ambulance Service LLC, operating authority in New York and Bronx counties, including community boards Bronx 5, Bronx 6, Bronx 7, Bronx 8, Bronx 10, Bronx 11, and Bronx 12. The ambulance committee recommends to vote in favor.
Okay, I will read the motion which comes to us as a seconded motion from the ambulance committee. Okay, the motion will be that the REMSCO of New York City, based upon the receipt of a complete application of transfer of operating authority of Empress Ambulance Service, Inc., 5930, to Paramedics Logistics Operating Company, LLC, and a review of competency and fitness having been conducted by the Regional Emergency Medical Services Council of New York City and the New York State Department of Health, and that review having revealed no issues challenging competency and fitness, recommends that approval of the transfer of operating authority of Empress Ambulance Services, Inc., 5930, to Paramedics Logistics Operating Company, LLC, operating authority in New York and Bronx counties, community boards, Bronx 05, Bronx 06, Bronx 07, Bronx 08, Bronx 10, Bronx 11, and Bronx 12 be granted. Before we open this motion for discussion, is there anyone here who needs to recuse themselves? Hearing none, is there anyone here who feels that someone should have recused themselves? Hearing none, I open the motion for discussion. Is there any discussion? Hearing none, we will now proceed to a roll call vote.
Sorry. Dov Jacob,
In favor.
Samia McEachin. In favor. Dominic Batinelli,
In favor.
Christine Mazzola,
Abstain.
Joseph Marcelino,
In favor?
John Johnstone,
In favor.
Robert Bristol,
In favor.
Martin Grillo,
In favor.
David Mekatansky,
In favor.
Scott Orlansky,
In favor.
Mordecai Lax,
In favor.
Martina Baccarella,
In favor.
Scott Chiang,
In favor.
Robert Krupe,
In favor.
Brian Levinsky,
In favor.
Megan Farley,
In favor.
Manfred Fuchs,
In favor.
Sean Graves,
In favor.
Jerry Gumbo,
In favor.
Yadidja Langson,
In favor?
Dennis Laurie,
In favor. Excuse me.
Mitchell Powell.
In favor.
Motion carries.
Motion carries. Thank you very much. Ambulance.
And continuing on with the ambulance committee report, the ambulance committee discussed the tag reports, in which you just heard Joe mention about the mapping issues, and mapping issues will be continued to go further. Also, too, was a discussion about the use of the ID card for the REMSCO ID card. It has been now discussed that we will now establish a tag to further discuss this in terms of operationability of that use of that card.
I'm sorry, just say the last part again.
Sure, that we discussed to maintain operationability of the card.
Thank you.
No other tag reports, no unfinished business. And that concludes the ambulance committee report.
Are there any questions for the ambulance committee chair? Thank you very much. We now move to training education committee report.
So Training and Ed did not meet, but I can report that to date, approximately 4,000 people between the REMSCO's LMS and REMSCO's online learning program and the hospitals that ran them, the agencies that ran them at their own sites, approximately 4,000 people have been trained outside of the fire department. So I think it's
Are
moving
there any
along.
questions? Thank you very much for your committee's work. We now move to the REMAC report. Dr. Krupe.
The Regional Emergency Medical Advisory Committee, REMAC, in New York City, met on April 16, 2019. The following is a meeting summary. The following items were approved: Statement of New York City REMAC Examination Policies and Procedures. Academic Integrity Policy Statement was revised to prohibit electronic devices, including mobile phones and watches, from the testing area. Simple calculus will be distributed upon request. Hashtag protocols, were approved. The ET3 alternative destination language was approved, and as mentioned by Dr. Langston, there was some wordsmithing that went on afterwards by the Executive Committee of REMAC, which went to the Executive Committee of REMSCO, which was approved as discussed.
It actually went both. First it
Yeah,
came to
yeah,
here,
right,
and we said, you better fix it. Then it came back to us, and we said, okay.
Correct. The most important thing was approved by both. And lastly, the Mobile Stroke Tribune, MCSU interface language was developed into an advisory, which has been distributed. And I think that came out of our last meeting. There was some issues raised and some confusion, which should be addressed in the advisory. The next meeting of REMAC will be held on Tuesday, June 11, 2019.
Are there any questions? Okay, Quality Improvement Committee report. I
There is,
wasn't there, I can't do it, so.
there is no quality improvement committee report.
Because it didn't meet.
There's,
We
we met, but there wasn't any new,
reviewed some stroke data.
yeah.
Okay, there is no report from the QI committee. There is no report from the State EMS Council. It's meeting next week. Stay tuned. And we now need to proceed to an election of the awards that we are nominating. Now, we have a ballot. Okay, and we're going to send the ballot out, distribute the ballot. They're numbered, okay? So you can't write your own ballot. And what you need to do is to check off for each category when there is when there are more than one person. And then we'll collect them and we'll count them. If you don't check anyone in a category, if you look at a category and you say both of these rascals shouldn't get anything, then just leave it blank. Okay? So, check them and just do this, and this is
I'll
mine.
take blank one there.
This is the blank one.
Now, when I sent out copies of the awards to everyone, and I just received, they weren't received late, we were having some difficulties getting them emailed to the office, but we got Kevin Mahoney for leadership and Ridgewood Volunteers for agency. So I have the applications here, if anybody wants to read them. Want me to pass them around? Once all the ballots are in, we'll have another member of the council tally up the votes. I was gonna put my daughter in, because she works at New York Press too, South Street in the ER, but I didn't think that anyone would like that. I'll surprise her.
Okay. If you can, pass your ballots back up when you're done, and we'll ask you and you to tally them.
Okay.
And if you get them back finished by the time this meeting is over, which I hope you will, we'll announce the winners.
Marie,
Yes, sir.
question for you. Michael Rednow, didn't he receive the award last year?
He's getting the award for EMS safety and quality this year. That award nomination is for EMS Physician of Excellence, I thought.
Yes.
It's correct.
Yes.
Yeah, it's a different category.
Different category. Thank you. I'm sorry?
Has everybody signed the transfer authority vote?
Brandon, I'll get it back.
It has your address on it. Do it.
I need the attendance sheet for REMSCO.
Yes, sir.
Here is this.
Thank you.
Thank you.
Yeah, we never approved the minutes.
Thank you. That's because I don't have a copy of it because you didn't give me the minutes.
But it says it on the agenda.
I know, but you
Don't
didn't
be
give me
yelling
the
at me.
minutes. There are no minutes here. Can't do it if I don't have it.
No.
Each one of us wants to put their own business. This is an unfair choice this year. I know. Who's that guy? I don't want to know.
Give me a copy of the minutes. You have them. While we are waiting, we have reminded ourselves that we did not approve the minutes of the March 26, 2019 meeting, which were distributed. I assume you've all done your homework and read these things carefully.
Motion in order?
There is a motion in order to approve.
Motion to approve the minutes?
Okay, thank you. Is there any discussion, corrections? Hearing none, all in favor of approving the minutes, say aye. Aye. Anyone opposed? Any abstentions? Please mark it as being unanimous. Thank you. We'll try to do a better job next time, and remember to do this first. I'll try to do a better job.
That's
Do it
okay.
first.
It's okay.
Okay.
You're forgiven.
Has everyone submitted their,
raise your
given
hand?
her our votes, my sheets, what I vote for?
You have to take these also.
Here.
You have the tally copy, right?
Yes.
Okay.
Okay, while they're busy counting, is there any unfinished business? Hearing none, is there any new business?
I don't think this is more new business, just a clarification question. Been receiving a lot of questions regarding the Methodist online medical control. I understand there's no contract that they're requiring.
No
Is this just for SLAMs, or is this for anything else? That's been a lot of providers have been asking questions about that.
Right now, I was given that number specifically for stroke,
Okay.
but Methodist has in the past always said that they are available to volunteers. I will specifically ask them if this is for all volunteers for all online medical control.
Gotcha. I'm sure they're just told people to call them. If they hang up on them, then just deal with it. But it's just been not clear.
Yeah.
You know, I've sent you a couple emails about it.
Good point.
Not about that point, but
Yeah.
other things.
I mean, that's what they've said in the past, for any volunteer that they'd
Gotcha.
be happy to do
Okay.
it. But I'll get it officially from them.
Thank you.
Is there any other new business? Yes?
Congestion pricing, is that something,
Loud,
congestion pricing going on in Manhattan in the next few years? Is that something that's gonna affect us regarding ambulances coming in, private vehicles that are emergency vehicles?
Wow.
From what I read, emergency vehicles are supposed to be exempt across the board. That's what.
But the question is, do we wanna have an official statement saying that commercial vehicles, commercial ambulances, private ambulances,
Why not? It can't hurt.
Okay, so
Good
we'll
question.
ask staff to prepare such a letter, which I will sign, and we'll
Just
send
an
it.
observation on this.
observe?
Is, I'd actually wait until the agencies and organizations have made a clearly identified process on this before we actually make a position on this.
No, what process are you looking for?
process?
From the state regulators and also the city regulators on how this is gonna, when it's gonna be effectuated.
I think we need to do
Once
this
they decide,
before
it might
they,
be too
before
late
they
for
make
us.
up their minds and screw it all up.
And it's gonna be screwed up already.
Okay, I mean, on both sides, with all due respect to the state, I don't want them to go back and say that I'm criticizing the state. But the city, I will definitely criticize.
Get it right in the
Okay?
first draft.
So, let's get in, make it clear that they don't forget about us, and let the staff create a letter, it's gonna be a big letter, okay, and I will sign it.
Okay.
And then you can send it off to everybody.
Question, you're also gonna cover emergency ambulance service vehicles?
That'd have to be part of it.
I guess so, anything that.
They're
Why not?
classified as an emergency vehicle, so it has to be.
And we can, you want us to address this to New York City Council, the chairperson of the, oh, God.
That's who it should go to,
Yeah.
with a copy to the state and a copy to whomever else. Okay?
Okay.
Send it to the governor.
Hmm?
Send it to the
Governor.
governor.
Right.
In terms of Easy Pass though, like private ambulance services have to pay fares when they go over through tunnels and bridges.
Right.
Okay.
Why would they find dispensation
Everybody
for
does
this?
now. Everybody does, so do volunteers.
Okay, but not New York City 911 ambulances though.
Well, because we may,
Everybody
I mean,
because
maybe the new
frankly,
ones, maybe the new
there
ones.
may be now people, ambulance companies, who are gonna refuse to take patients to Manhattan hospitals because it's gonna cost them much more money. And we should not allow that to happen. That should not be part of the decision of where you take your patient based on whether or not our mayor and our governor think they need more money from us.
They should clearly identify
Okay.
what an emergency vehicle is.
So let's just write this letter and get it on the table, and they'll choose to ignore us anyway, but at least we'll be there first.
Over the past 3 years, Triborough Bridge and Tunnel has not issued any non-revenue passes to any additional ambulance fleets here in the city.
That's
You
another
have-
issue, and I believe we might want the ambulance committee to come up with some discussion on that, and maybe then we should have another letter.
Say that
Okay.
again, what was that?
So the MTA and TBTA has not issued any additional Easy Pass, the orange tags, non-revenue tags, to any ambulance service beyond what they originally was issued years ago.
Years ago,
So if your
right.
fleet, so if you had five ambulances 3 years ago, and now you have 10, you had to go out and buy additional Easy Pass tags and pay the tolls.
And if you travel through without the Easy Pass and you get a bill, do
You have
you
to pay the
still
bill.
pay the bill, or you write ambulance?
So I'm speaking from experience, because my trucks are constantly on the Verrazano Bridge at $19 a head and double axles in the back. Every time we go on that bridge, we pay the toll.
This is definitely something that we need to discuss. Put it on the ambulance committee agenda for the very next meeting.
Double axles.
Double price.
Would you be
100%.
interested in sharing that tag, since you have
Absolutely.
information on it?
Absolutely.
Thank you.
I second that motion that he chair that tag.
You're the
No, I'm
vice
done
chair.
with my.
You're the vice
You know,
chair.
these bridges have a lot to do with mapping, though.
Right.
Okay. Is there any other unfinished business?
Sorry. You don't have
Okay,
to.
how close are we to announcing the? Close. So let's just pause for a moment. Okay, take a breath, stop typing. And we'll go back on the record as soon as they finish tallying. And no one better ask for a recount. This is not politics. Get this.
He's not lying, but the camera's still rolling.
Get all of this in a minute and finish.
This is not official, but you don't have to type this. You like the sandwiches? Were they okay?